Bruce Willis FTD battle expert warning signs. What no condition. Association for Frontotemporal Degeneration CEO discusses details of frontotemporal dementia. Bruce Willis's frontotemporal dementia, FTD, diagnosis is bringing more attention to the rare condition. For World Frontotemporal Dementia Awareness Week, Willis's wife, Emma Hemming Willis, and the Association for Frontotemporal Degeneration CEO Susan Dickinson spoke on the Today show about the actor's health status and shared details of the disease. Dickinson, who is based in Pennsylvania, explained what happens to patients facing FTD, mentioning how the path to a diagnosis can be one of the most confusing parts. Because it is less common. Most doctors aren't familiar with it, she said. It can take almost 4 years for people to get diagnosed on average. Often, Dickinson revealed, patients are misdiagnosed with other conditions such as bipolar disorder, depression, Alzheimer's disease, or even Parkinson's or ALS. Hemming Willis said FTD is different from these other cognitive diseases, as the condition can also affect movement and speech. Dickinson added that it can also impact behaviors, personality, and executive functioning, which includes the ability to plan ahead, meet goals, display self-control, follow multi-step directions and focus despite distractions, citing Harvard University's Center on the Developing Child. FTD can be indicated by unexplained changes in behavior and personal presentation, the expert mentioned. So, somebody who normally speaks absolutely fine has trouble putting their thoughts into meaningful sentences, she said. Or they may lose the meaning of a specific word. Maybe a person who always managed the family's finances all of a sudden has trouble balancing a checkbook. Emerging problems at work can also be a warning sign, Dickinson added. Somebody who's always performed well is either making poor decisions or just isn't completing tasks, she said. Hemming Willis admitted that it's hard to know if her husband is aware of what's going on with him. Because the disease can begin in the frontal or temporal lobes of the brain. Dickinson confirmed that it can affect self-insight. We really don't know, she said. Some people, the first thing they lose is any understanding that they themselves have changed, and other people retain that for a long time. FTD can be passed on genetically, Dickinson noted, as the genetic mutation is present in about 25% of people, but the condition is sporadic in most patients. She added, we do not know yet what causes the condition, which is one of the challenges. FTD accounts for an estimated 10% to 20% of all dementia cases, according to the Association for Frontotemporal Degeneration.